Do you think with the TFOS criteria, it's enough?
I think that, yes, the TFOS definition of dry eye is significant, and we have to follow the what is inside this definition if we want to screen our dry eye patient. I think that the screening must be complete, and so we need to check of course, osmolarity, we need to check inflammation, we need to check all the topics that they suggest us. I think it's complete now.
It's complete, okay. Rolando?
All right, so you heard my problems with the current definitions. I don't think they help doctors, and I don't think they help patients, because it doesn't get to the heart of the problem. It still is focusing on the eye, and that's not where the focus needs to be. It's the glands that are making the tear that we need to be focused on. And we need to be, when patients come to me, say they've seen several doctors, and the first thing that I'm talking to them about is diet and their skin and their glands. They say, no doctor has ever talked to me about my skin or my skin products or my diet or my habits. So I think we need to change the definition. And I also think that we need to change the definition for the young doctors coming in, because we're putting a bias in them to, again, look at the eye and not take the patient as whole and not a holistic approach.
You have to fix the whole body.
The whole body.
Okay, thank you. Serge?
Yeah,
You can speak in
agree,
Vietnamese, Chinese, or or French, or English.
You know, I'm a TFOS ambassador, so I cannot say anything about it. But I think it's a little bit reductive to have this criteria, because dry eye is not only aqueous deficient or evaporative dry eye. As you say, there are many causes, and the lids are very important, and it reduces the kind of examination that you will do. And the machines are very important for us, but you have to keep in mind that the ocular surface is a whole, and the ocular examination is very important. For example, friction, you don't talk about friction. You don't talk about epitheliopathy of the conjunctiva. You don't talk about many parameters that you should examine during your clinical examination. So a definition is good for a whole a box, but in the real life, as you say, it can help to screen very quickly people between evaporative and aqueous deficient, but it will not help in the most difficult cases, because dry eye is more complex than just 2 or 3 lines.
Perfect. Carlos?
Well, I think that TFOS is a general guide. And then something general, it doesn't arrive to cover all the subjects. And I think it can help, but I completely agree that now dry eyes is another story. I agree with Rolando. Talking about the dry eyes is like the iceberg model. We see only maybe the eyes, but below the sea, there are more and more things, mental, nutritional, metabolic. There are many things that generate inflammation in general in our body. And also, of course, the eyes participate in this inflammation. So in this moment, we need to move to another guide. This is my impression.
I agree. All the pearls are underwater.
Yeah.
Okay, so the majority agrees with the need for something more precise.